Hi everyone, my name is Dr. Sangeeth Kumar. I'm a consultant nephrologist. I'm working in Tiruvalla Medical Mission Hospital in Tiruvalla in Kerala. So today we'll be discussing about what pedal edema is and how is it related to chronic kidney disease, what are its causes, symptoms, and treatment. So let's begin today's session. Pedal edema is a very important clinical sign. So what is pedal edema and how is it related to kidney disease? So first let me explain what pedal edema is. Pedal edema is a condition in which excess fluid accumulates in the lungs and feet, causing them to swell. This swelling can happen for various reasons. It can be either due to disease of heart or a liver disease or an issue of thyroid or a kidney problem or if there is a clot in the major vessels of the legs. Our body fluid is divided into two main spaces. One that is inside our cells. It is known as intracellular space. The other, which is outside, known as extracellular space. The extracellular space is further divided into two. One that is around the cells and the interstitium, and one that is within the blood vessels, known as the intravascular space. The extracellular space hence includes two things, the interstitial fluid as well as the intravascular fluid. The edema or swelling occurs when there is an abnormality in the distribution of fluid between these two spaces. The problem can occur due to various reasons. If there's too much pressure build up in the blood vessels, often seen in heart disease, or if there's excess amount of fluid in the body, which is usually seen in disorders of the kidney, if there isn't enough proteins, especially important proteins like albumin, which help to keep the fluid in the blood vessels, which is usually seen in liver diseases. Additionally, the lymphatic systems, which help to move the extra fluid and proteins back into the system, it can also be not be working properly. Diseases of the lymphatic can also cause edema and leg swelling. The kidney plays a major role in the regulating the body's fluid status as well as the elimination of the toxic products like urine creatine which our body generates. The kidney is a major regulator of the fluid balance of the body. When they are not functioning properly, as in various renal disorders like acute kidney disease, when there is a transient decline in the function of the kidney, or a chronic kidney disease, when there is a permanent decline in the function of kidney, or a nephrotic syndrome, when there is a swelling or an abnormality in the filters in the kidney, all these disorders can lead to accumulation of fluid in the extravascular and the intravascular spaces, which can lead to edema. So, edema is one of the major symptom and a sign of CKD. Now, if a patient comes with edema, how should a physician approach or how should a clinician approach? First, you should take a detailed history. The detailed history should include all the conditions which can lead to edema, such as a disease of heart, any history of thyroid disease, any history of liver disease, any history of kidney disease, or any history of trauma, or any history of lymphatic disorders. All the disorders which can lead to edema must be properly inquired and taken. This edema, then coming to the examination, this edema can be a localized edema or a generalized edema. As the term implies, the generalized edema, the fluid is distributed over the entire large areas and it is distributed over the entire body. It is usually distributed to disorders of the heart or a kidney. On the other hand, the localized edema, as the term signifies, the edema is restricted to a small area of the body. It is usually seen in obstructions of the major veins of the lungs, the major veins of the legs, or in the obstruction of the lymphatics. So, edema can be generalized or a localized. Localized edema is usually due to a local cause. Generalized edema is usually due to a systematic cause. Coming to the examination, the edema can be a pitting edema or a non-pitting edema. Pitting edema means the edema indents after pressure. It's usually seen in heart failure or nephrotic syndrome. On the other hand, a non-pitting edema, it usually suggests a lymphatic obstruction or a hyperthyroid disorder, that is a disorder of the thyroid. In the case of renal disorders, the edema is usually generalized. That is, it involves all of the body. It involves the lungs, legs, it can involve the eyes, it can involve the lungs where it causes breathlessness. So, the patient with renal disorder comes to you with edema, we should have a proper history taking and we should do the proper investigations. Now, what investigations we should do? First, we should do a complete blood count. Then you should do a renal function test, which should include a serum creatinine. Then you should do a routine urine analysis, examination of urine protein, examination for urine microalbumin, a serum albumin level, a USG abdomen to look for any abnormality in the kidney structure. So the basic test which can help us to know whether we have a kidney disease, and if the kidney disease is there, it helps us to correlate with our findings. Now, when it comes to managing edema, the approach depends whether the edema is a localized edema or a generalized edema. If the edema is localized, as we already see in disorders of the lymphatic system, we need to address the local cause. So, localized edema, it usually responds to limb elevation, compression stockings, which is usually seen in varicose veins, or a physiotherapy, or an ice bag application. All these local causes this edema solves. On the other hand, treatment of generalized edema needs to address the cause of the systemic disease that is causing the edema. That is, whether it's a cardiac disorder, or a heart disease, or a liver disease. But the major part is fluid restriction and salt restriction. Salt restriction, we should limit the daily intake of salt to less than 4 to 5 grams per day. Drugs which are known as diuretics, which help in relieving the body of edema, are also a key role in the resolution of edema. The diuretics can be a loop diuretic, or a thiazide diuretic, or a potassium sparing diuretic. Also, we should use the diuretics very cautiously, as the diuretics, though they relieve us of edema, but they are harmful as they can cause hypertension, electrolyte imbalances like hyponatremia, hypokalemia. So, regular monitoring of the fluid status, urine output, blood pressure, and weight is essential when we treat the patient with diuretics. So, in managing a patient with a chronic kidney disease who has an edema, we should focus on salt restriction, that is, restricting the salt intake to less than 4 to 5 grams per day, restricting the amount of fluid which is taking. Since the kidney is the culprit, the amount of fluid which we are taking, the body is not able to excrete it. So, we should restrict the amount of fluid which we are taking. At the same time, we should use high dose of diuretics which help us to relieve of the edema. Managing edema, hence, is a tailored approach. It involves proper history taking, identifying the cause, proper treatment, which involves pharmacological treatment, as well as non-pharmacological treatment, that is, salt restriction, use of fluid restriction, etc. So, a patient education is very much crucial. Understand the condition, understand the treatment plan, making the lifestyle modifications can improve the outcome in patients with edema. Early recognition and effective management help prevent complications. So, join us in the National Edema Awareness Day on September 25th to increase awareness and promote early detection of edema and its related conditions and help in the benefit of the patient. Together, we can manage and understand edema better. Thank you for watching this.